2 minutes connecting. Okay. Connecting almost. Okay, we are live. Good morning, everyone. Welcome to Suthaletics and wishing everyone a very happy yoga day. It's a pleasure to invite Dr. Satish Pathak on board Suthaletics. He is from Kevalidham, the scientific research department of Kevalidham, Lonavala. And his credentials are absolutely fantastic. He has a long list of qualifications, but just to give you a brief, otherwise we will have to spend a lot of time on this. Dr. Pathak also has a lot of experience. He has been awarded, he has the Yoga Ratna Award by the Vishwa Yoga Darshan and Patanjali Yoga Center, Sangli, Maharashtra. He is the Assistant Director at the Scientific Research Department in Kevalidham, Associate Professor, College of Yoga, Kevalidham, and also the Vice Chairman of the Indian Yoga Association in charge of the Maharashtra unit. A little bit about his work, his professional memberships. He is the Visiting Operating Surgeon at the Sarodhya Trust in Gujarat, Honorary Surgeon of the Indian Cancer Society, Faculty Member, College of Physicians and Surgeons in Mumbai, Faculty Member, Kevalidham, Lonavala, Faculty Member, Mangalore University. He is the patron member of the Red Swastik Society in Mumbai, and also the trustee member of the Jagdisha Foundation in Nasik. And we could go on and on, but guys, this is fantastic to have such a learned, such an esteemed person with us today. And Dr. Pathak is going to talk to us about the scientific view of yoga, and I'm sure we all will benefit from it today. Over to you, Doctor. Please go ahead.
Yeah. Good afternoon, everybody. I will start with the prayer. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Guru Sakshat Parabrahma, Tasmain Sri Gurave Namaha, Tasmain Sri Gurave Namaha. With due respect to Swami Kovalananji, Mehtaji, and all yoga lovers. Today's my topic is scientific view of yoga. Today being the International Yoga Day, I will wish everybody on the day of occasion of Yoga Day. Since morning, everybody is doing some kind of yoga, kriyas, asanas. So those who are the newcomers, those who have never practiced, but today for the first time they are practicing, they must be thinking, has it got some meaning? So for those people, I'm going to talk, because nowadays, if you tell something to do, the next question asked by the person is why I should do it. So I'm going to give the answer to that why, so that you will develop faith into yoga and you will be able to do it regularly. Because in future, we have to make this as our daily lifestyle. The scientific view of yoga. Now this is important. So first, going to that point, we'll just discuss what is total health. Total health defined by WHO is that health which is at the level of physical, mental, social, spiritual, and now we are adding emotional also. As a doctor, I can offer only at the physical level, health. But all these levels, I cannot give anything. But this can be achieved by practicing yoga, and that is why the importance of the yoga. Now, suddenly, why the yoga has become important in 21st century? Because of the modernization, civilization, our mind has become like a machine. And that is why the problems are occurring. Then fast life. In Mumbai, Pune, person starts for the office right in the morning at 7 o'clock, travels 1.5 hours, reaches the office, works there for 10 to 5. After 5 again, he travels for 1.5 hours, reaches home at 7, 7:30, takes little breakfast, then watch the idiot box for 1 hour, read some paper. 8:30, 9 o'clock, he takes dinner and go to bed. Oh, I'm tired, whole day I was working. Has he done anything for his health? Nothing. So the life has become very fast. Then fast food. What do you mean by fast food? In olden days, what was the proverb? हमारे पूर्वजों ने हमारे लिए क्या ये बताए थे? कम खाओ, खूब चबाओ, यही है तंदुरुस्ती का खजाना. लेकिन ये प्रॉवर्ब भी हमने बदली कर दिया. अभी क्या है ये प्रॉवर्ब? खूब खाओ, कम चबाओ, यही है फास्ट फूड का जमाना, जंक फूड का जमाना. And that is how the problems are occurring. And lastly, the mad race. What is this? The marathon which is arranged? No, it is not that. If my neighbor has got 29 feet color TV, I should have 40 inch. If he has got 40, I should have 60. If he has got a small car, I should have big car. And for that, what you do? You work more, you earn more. And when you achieve everything, you have got a car, you have got a bungalow, you have got bank balance, then you say, okay, now I'll enjoy. But by that time, you are reached 50 and diabetes, blood pressure, they are already have come and met you. So if somebody brings sweet, what you say? No, you only eat because I got diabetes. Doctor has not allowed me to eat. Then this is a rainy season. You say, okay, we'll go for a trekking. You say, no, I got a blood pressure. No, I cannot go. So when you will enjoy. So the important thing is that when you are working, earning, at the same time, if you practice yoga, you can keep yourself healthy. In 21st century, another most important point is the and diabetes, blood pressure, they are already have come and met you. So if somebody brings sweet, but you say, mute somebody eat because I got diabetes, has not allowed me to eat. Then this is a rainy season, you say, okay, we'll go for a trekking. You say, no, I got blood pressure, no, I cannot. So when you will enjoy. So the important thing is that when you are working, earning, at the same time, if you practice yoga, you can keep yourself healthy. In 21st century, the most important thing is the pollution. Nowadays, there is a lot of pollution, and then that is why the problems are occurring. 21st century is called century of tension. And what are the diseases caused by tension? First thing, it is causing mental tension. And the diseases caused are diabetes, blood pressure, heart attack, obesity, constipation, asthma, and most important, the psychological problems. Now you know that malaria is caused by some organism. Typhoid is caused by some organism. Is there any organism which is causing diabetes, blood pressure, myocardial infarction? There is no organism. And what problem is there? It is because of the mental tension. So that is why it is said, behind every disease there is a cause and no drug can reach that cause. हर बीमारी के पीछे कोई तो कारण होता है और कोई भी दवा वहां तक पहुंच नहीं सकती. वो क्या है? वो मन है. ऐसे मन को सेट राइट करने के लिए सबसे अच्छा कौन सा मार्ग होगा? तो योग का मार्ग है. And that is why the importance of the yoga. Can we treat mental stress with medicine? एलोपैथी में हम मेंटल स्ट्रेस को, तान तनाव को ट्रीट कर सकते हैं क्या? No, but we can treat it with yoga. पुराने जमाने में medical expenditure was in few hundred rupees, but now it has gone to few hundred lakhs rupees, which a common man cannot afford. And that is why everywhere, all over the globe, people are looking for alternative path to allopathy. Yoga is most important path which people are searching for. योगा जो है ये 5000 साल पुराना है, टाइम टेस्टेड है. यदि योगा का प्रैक्टिस हम करेंगे अंडर द सुपरविजन ऑफ द टीचर और योगा एक्सपर्ट, then we will not going to get any problem. कई लोगों का ऐसा समझ होता है, मिसकंसेप्शन, कि योगा करने का मतलब वो बुढ़ापे में रिटायर होने के बाद जंगल में जाके कच्चा फल खा के करने का है. ऐसा है क्या? ऐसा नहीं है. ये संसारी लोगों के लिए है. हम अभी भी योग को इतना ध्यान नहीं देते, इतना महत्व नहीं देते हैं. पाश्चिमात्य लोगों ने इसका महत्व समझ लिया और इसलिए मैं हमेशा कहता हूं कि हमारा जो योग था ना, इसको अमेरिका का ए लगा और योगा हो गया, मॉडर्न हो गया. कई लोगों का ऐसा समझ है, गलत फहमीन है कि योगा बुढ़ापे में करने का, रिटायर होने के बाद करने का. तो ऐसा नहीं है. योग ये सभी उम्र के लिए अच्छा है. शास्त्र कहता है युवा वृद्धोति वृद्धो वा व्याधितो दुर्बलो पिवा अभ्यासत सिद्धि मापनोति सर्व योगेश्वर तंद्रिताः. मतलब योग जवान कर सकता है, मिडिल एजेड कर सकता है, ओल्ड एजेड कर सकता है, सीनियर सिटीजन कर सकता है, जो बीमार है वो भी कर सकता है, और जो शारीरिक तौर पे दुर्बल है, सभी लोगों के लिए योग का अभ्यास है. हम मॉडर्न 21वीं सदी में आए और सब लोग मॉडर्न आधुनिक विज्ञान की तरफ दौड़ते हैं, तो हम एक चीज भूल गए. I always tell that we have forgotten the holistic approach. In 21st century, what we have done, we have fragmented our object, the human being, in multiple pieces. हमारे पास कान का स्पेशलिस्ट अलग, आंख का अलग, अतड़ी का अलग, हार्ट का अलग, किडनी का अलग, अलग अलग स्पेशलिस्ट है, अलग अलग गोलियां देते हैं. लेकिन योग जो है ये सर्वांगीण उन्नति का होलिस्टिक अप्रोच है. यदि जो भी कुछ हम आपको बताएंगे, यदि ये सब अभ्यास आप रोज करेंगे तो आप बीमार नहीं होंगे, बिकॉज ऑल द सिस्टम्स विल फंक्शन प्रॉपरली. और हमारे के शरीर की सभी सिस्टम, दे आर इंटरलिंक्ड, दे आर वर्किंग टुगेदर, दे कैन नॉट वर्क सेपरेटली. योगा हैज गॉट ए प्रिवेंटिव एस्पेक्ट. यदि आप मेडिकल कॉलेज में जाते हो तो वहाँ पे अलग अलग डिपार्टमेंट होते हैं, सर्जरी, मेडिसिन, पीडियाट्रिक्स, गायनेकोलॉजी. वहाँ पे वो बीमारी के पेशेंट आते हैं, उनका निदान किया जाता है. और वहाँ पे एक डिपार्टमेंट है, उसको कहते हैं प्रिवेंटिव एंड सोशल मेडिसिन या कम्युनिटी मेडिसिन. उनका ब्रीदवाक्य क्या है? प्रिवेंशन इज बेटर देन क्योर. रोग का सबसे अच्छा इलाज क्या है? तो रोग होने न दे, यही सबसे अच्छा इलाज है. तो ऐसे रोग प्रतिबंधक तत्व के ऊपर हमारे मॉडर्न मेडिसिन का एक डिपार्टमेंट काम कर रहा है. उसी तत्व के ऊपर ये योग का अभ्यास है. मैं हमेशा एक उदाहरण देता हूँ. दिस इज द पिकनिक स्पॉट and people go here for picnic. If somebody falls down from here, we have kept a hospital, ambulance, doctors and instrument. We have spent 10-20 lakhs rupees to erect the hospital. But if we put a fencing over here, nobody will fall down and you will not recover all this money. Similarly, if you practice yoga, it sets the biological clock of your body in such a way that it will not go wrong. And if something happens, you can add some more kriyas. And that is the beauty of the yoga. One more basic thing. What are the basic things required for our body, priority wise? If you don't get, will not survive. What is the first? Air. Second, water. Third, food. हवा, पानी और अन्न. लेकिन ये प्रायोरिटी भी हमने बदली कर दी है. आज के मॉडर्न युग में प्रायोरिटी क्या है? पहले हम बहुत खाते हैं, फिर थोड़ा सा पानी पीते हैं, और हवा को कैसे कहते हैं? भाई हवा अंदर नहीं जाएगा, बाहर रह जा. एंड देन प्रॉब्लम्स अकर्स. सो इफ यू फॉलो द, इसलिए एक शॉर्ट में बताते खाने के बारे में हम, कि पेट के 4 हिस्से करो, 2 हिस्सा खाना खाओ, 1 हिस्सा पानी के लिए रखो और 1 हिस्सा हवा के लिए रखो. यदि इसका हम आचरण करेंगे और साथ में योगा का अभ्यास करेंगे तो हम खुद को स्वास्थ्यपूर्ण रख सकते हैं. अभी आज काफी लोगों ने योग का अभ्यास किया होगा. कई लोगों ने षट चक्र के बारे में सुना होगा. ये चित्र भी देखा होगा, ऐसे चक्र है अलग अलग. ये काल्पनिक है क्या? ऋषि मुनि ने जब किताब लिखा तभी तो उन्होंने कहा कि यहाँ पे आज्ञा चक्र है, यहाँ पे विशुद्ध चक्र है. उन्होंने लिखा, हमने पढ़ा और हम आपको बता रहे. आर दे इमेजिनरी? or they are there in our body? They are there in our body. That is why I'm showing it, because you should not think that yoga is a mystic. It is a science, and it has been known for last 5,000 years. So I'm going to show you the correlation between the chakras from yogic point of view and medical point of view. This is the Mooladhara chakra, which is situated near anal opening. From medical point of view, it is called pelvic plexus. This is the medical depiction, and this is the yogic depiction. How many petals are there? 4 petals. What is the importance? I will tell you at the end. स्वादिष्टान चक्र नियर प्यूबिक सिंपैसिस या पेड़ों के स्थान पे होता है. डॉक्टरी भाषा में उसको aortic plexus कहते हैं. From medical point of view, it is, we will call it aortic plexus. This is medical depiction, and this is the yogic depiction. How many petals are there? 6. Manipur chakra near umbilicus. From medical point of view, it is called solar plexus. This is medical depiction, and this is the yogic depiction. How many petals are there? 10. Anahat chakra, from medical point of view, it is called cardiac plexus. This is medical depiction, and this is the yogic depiction. How many petals? 12. Vishuddha chakra, it is there in the neck. From medical point of view, it is called cervical plexus. Medical picture is not shown over here. Yogic picture is like this. Petals are 16. Agnya chakra at the center of the forehead here. From medical point of view, it is called optic thalamus or optic chiasma. This is the medical depiction, and this is the yogic depiction. How many petals? 2. How many branches? When we saw operated, we saw it like that. So here you see the petals are 2, branches are 2. Similarly, in the previous chakras, when we say 6 petal, 10 petal, 12 petal, 16 petal, same number of branches exist. That means sages were knowing the human anatomy and physiology, and they have devised the yogic practice in such a way, if you practice it regularly, you can keep yourself healthy. Now this is the vertebral column. Reed ki haddi hai. This is the chain of the chakras on the side of the vertebral column. And from here, the nerves come out and they supply to the different parts of the body. Which are they? This is the eye. This is saliva secreting gland. These are the lungs. This is the heart. This is the stomach. This is the liver, spleen. This is the pancreas, Swadhupinda. These are the small intestine. And these are the large intestine. And this is the kidney. All these organs are controlled by these chakras through these nerves. Now, suppose somebody says, yesterday I had gone for a dinner, there was a party, and I had little excess food. So morning I skipped my breakfast, and I will take only buttermilk and rice into the lunch. Where is the problem? Problem is into the stomach. Somebody has got asthma. He has to use the nebulizer. Where is the problem? Problem is into the lungs. Somebody has got heart attack. Where is the problem? It is in the heart. Somebody's kidneys are damaged. Where is the problem? Here. He has to undergo dialysis twice a week. Means if any one of these organs is not functioning properly, you are called sick. If all these organs are functioning properly, you are healthy. When they will function properly? When control is proper. When control is proper? When all these chakras are functioning properly. And to activate these chakras, we do Omkar. How do we do Omkar? We first breathe out, then breathe in. The vibration generated by this Omkar, they go on activating all the chakras. They are activated, they are functioning properly, control is proper, organs are functioning properly, and you are healthy. So that is the importance of the yoga. If you read, you go on Google and type the name, Dr. Herbert Benson. He's a scientist. He has studied, he has done research on Omkar, and he came to the conclusion that Omkar a day keep the doctor away. So that is the importance of the yoga. Now, you have heard a lot of things that it is not mystic, it is science, all that. Okay, you might ask me what yoga we should practice. So I'm just giving in general few things. The first is the prarthana, prayer. Which God's prayer? I'm not propagating any particular God, but it is, you slept in the night. and you got up in the morning. How you got up? Nobody has woke you up. Some energy, किसी शक्ति ने आपको उठाया ना, तो शक्ति की प्रार्थना करो कि आज मुझे आपने जगाया, आज का दिन मुझे बोनस मिल गया, so I will work properly, I will utilize the day properly. Then breath awareness means just watch the breath, concentrate on breath, close your eyes and just watch breath, how it is coming, how it is going. Then netrasana. What is netrasana? When you get up in the morning, you brush. After that, what you have to do? You have to drink little water and hold it into the mouth, and it will be like this, holding, and then take water in your palm and then flash it on your open eyes 10 to 15 times. Then throw out the water from the mouth. Again, you take another water. Again, flash 15 times on your eyes. So this is called netrasnam. This you should do in the morning. And then in the afternoon, when after lunch 2-3 o'clock, when you are feeling sleepy, that time you should do it. It will help to remove your lethargy. Eye problems will be reduced. Then Brahma Mudra. Now, what is this Brahma Mudra? This is for cervical spondylitis. Nowadays, most of the people, they are working in the office on computer. So they are sitting in front of the desktop for 6-7 hours. And then evening, what they say? Oh, my neck is getting pain. Why it is getting pain? Because you develop cervical spondylitis. For that, we do Brahma Mudra. What you have to do? You have to sit like this, then keep your neck loose, and then slowly turn to the left. Let the chin go above the shoulder. Then come in front. Come into the center. Then go to the right. Again come in front. Then second type, you have to see up toward the ceiling. Come slowly in front. Then those people who has got active cervical spondylitis, pain into the neck, they will not do this. Then you have to come down. Let the chin touch the chest. Then third is the, just tilt it on the left. Again come center, again go to the right. Again, next type is you have to rotate. Make a wide circle. 3 times this way, 3 times opposite time. All these things you have to do with close your eyes. Because if you do it with the open eye, sometimes you may get giddiness. Why? Because the balancing apparatus is into the ears. When you are doing these different movements of the neck, they get little confused. And that's why you feel giddiness. So whenever you are doing Brahma Mudra, you should close your eyes and do Brahma Mudra. After finishing the Kriya, at least half a minute, you should keep your eyes closed. One more important thing I will tell before you should do Brahma Mudra, that those who are practicing sitting in front of the computer for hours together, what they should follow, that the desktop level should be at the level of your eyes. It should not be below or it should not be up. Because if it is below, what will happen? You will do like this. If it is above, you are doing like this. And then you are getting neck pain. So you should not bend your neck when you are working on desktop. So this precaution you should take. Then next is the shoulder movement. Now those people who are traveling for 1.5 hours into the local train, if they don't get place to sit, what they will do? They will stand up and try to hold the hook and stand for 1 hour like this. And then after a few months, what happened? Oh, I'm getting pain into the shoulder. I cannot raise my shoulder. That is called frozen shoulder. For that, we give shoulder movements like this. You have to make circle clockwise and anti-clockwise. This is the shoulder movement. Then comes the Jalaniti, Jaladhauti, Kapalbhati, Agnisarudyan, Bhujangasan, Naukasan, crocodile poses, and Tadagi, rolling of tummy, rolling on tummy. Now we'll go one by one. Jalaniti. Now Jalaniti, we are supposed to do like this. This is a neti pot. You take into this lukewarm water and little salt is added. And then what you do? You have to apply it to the nose like this. So water, because this reservoir is at a higher level, it will go through this nostril, it will come out from the other and it will come out. This is, if you adjust the angle properly, you can do it without any problem. Now this is called Jalaniti. What is the benefit of doing Jalaniti? Now this is the cut section of the nose. You have taken sagittal section like this. So water will go in from this side and it will come out from the other side. So whole of this passage will be clean. Whatever dust particles are there, they will be thrown out. In rainy season, now people will get cough and cold, allergic rhinitis. So what will say? My right nostril is blocked. Why it is blocked? Because of the infection, viral infection, this mucosa gets swollen and there is a water logging. And so you say that right nostril is blocked. If you are doing Jal Niti, what we have done? We have taken lukewarm water into this neti pot and little salt is added. What is the peculiarity of the salt? If you put salt on the table in one small utensil, in 1 hour's time it becomes wet. Why it becomes wet? Because it absorbs the moisture from the atmosphere. Similarly, when you are doing Jal Niti, the salt into this water, it will absorb the water from this mucosa and the swelling will get reduced and your nasal block will go. So this benefit you get by doing Jal Niti. What another benefit you get? This is a small closed room. This is one closed room. This is another closed room. What is this called? Sinus. There are two frontal sinuses, two maxillary sinuses and two ethmoidal sinuses. They are small closed room. It is lined by mucous membrane which secretes little water. It cleans all these walls and throws out water through this window into the nose. Suppose this window gets closed, what will happen? This dirty water will collect over here. Can you see this dirty water collected here? And then what you say? He has got a sinus problem. What are the symptoms? If you ask some patient, what is the trouble? He says, I feel heavy over here or heavy over here. Why? Because this dirty water has collected. When he comes to me in the hospital, what I do? I do the antral puncture. What we do? We put a metal tube through this and it pierces this wall and drain out this water. Moment I take out this tube, this opening will close, again dirty water will collect. Means in allopathy for sinus, there is no 100% relief. But if you are doing Kapalbhati Niti every day, this door will never get closed and you will not get sinus problem. So this is the important benefit of doing Jal Niti. When it is to be done? It is to be done in the morning. When you get up after you brush, immediately after that you should do Jal Niti. You should not do it in the evening, preferably, because can you see this? These are the turbinates over here. So when you are doing Jal Niti, some of this water can get stuck underneath this. And when after doing Niti, suppose you lie down immediately, what will happen? This water will trickle down into the trachea and may go to the lung and you may get infection. So you should not lie down immediately after doing Jal Niti, and that is why preferably you should do in the morning. And 2 sets of Kapalbhati if you practice, water was stuck over here, it will be thrown out and there is no danger of getting pneumonia. So these benefits you get by doing Jal Niti. Next is the Vaman or Jaladhoti. Now what is this Vaman or Jaladhoti? Those who are new, I will just explain. The Jaladhoti is meant for acidity. If you ask how many people have got acidity, at least 80% people will raise their hand. What are the causes of acidity? Acidity is mostly more than 50-60% is because of the mental tension. And just now we saw that 21st century is called century of tension. So 60% causes mental tension. Remaining is because of our very good habits of drinking, smoking, tobacco chewing, spicy food eating. If you are practicing yoga, if you are doing Omkar, Gayatri, Dhyan, so what will happen? Your mental tension will be reduced. So 50% acidity will be reduced. And then if you are following the yogic diet, remaining acidity will be reduced. And suppose if something remains, that we can do with get away by doing Jaladhoti. Now what you have to do in Jaladhoti? You have to drink in the morning when you are brushed, then before eating anything, take 5 to 6 glasses of water, lukewarm water, add little salt into that and just sit and slowly drink the water. Once you drink 5 to 6 glasses of water, then you have to stand up, then put both arms on the knee joint and then trickle the posterior pharynx with the 2 fingers and take your tummy inside. whatever water comes out, let it come out. That is called jaladhauti. Now, how you get benefited with that? Before talking about the benefits, we'll see the anatomy of the digestive system. It starts from the oral cavity. This is the esophagus, food pipe. Then this is the stomach, jathar. Then these are the small intestine. These are the large intestine. This is the pancreas. This is liver. This is gallbladder, pittashay. Now, whatever you eat, it comes into the stomach. It stays there for 2.5 hours. It is digested. And then it goes ahead. Now, in an acidity patient, hyperacidity patient, after 2.5 hours of lunch or dinner, what remains here? Because food got digested and it has gone ahead. So what remains here? Here the excess acid. When this acid comes up over here, what you say? I'm getting heartburns over here. Or it crosses this line, because this line on this side is the acidic medium, on this side is the alkaline medium. When this acid crosses this side, it causes corrosive action and you get ulcer. So if you don't want to have acidity or ulcer, what is the ideal thing? That here there should not be excess acid and it should not go to this side or this side. For that, what we do, we see later on. This is the pancreas, Swadupinda. It is behind stomach. It secretes insulin and it controls the diabetes or blood sugar. How we control this, that also we'll see in the next part. How many intestines are there? There are 23 feet small intestine and 6 feet large intestine. All these intestines, they are put in your abdomen, stuffed into the abdomen. One end is fixed over here, another end is fixed over here, and it is connected to the posterior wall of the abdomen by this mesentery, parda, mesentery. When obesity there's a lot of fat is deposited into this, and then you get problem. Now this is the excretory system. These are the two kidneys, mutrapinda. This is the filtration plant of the kidney. What happens here? When blood comes over here, it is filtered. What it filters? What is unnecessary, what is harmful, what is toxic, what is not required by the body, it is filtered and thrown out in the form of the urine. So this urine comes out along this way and is thrown out. So this is kidney, ureter or bladder. Mutrapinda, mutranalika, mutrashay. Now you must have heard somebody is getting stone. Where you get? Either you may get a kidney, you may get into the ureter, or you may get into the bladder. How can we get rid of that? That we'll see in the next part. Now we have seen that anatomy of the digestive system. Now when I explain the procedure of Jaldhauti, what we have done? We had taken 5 to 6 glasses of water. Where it will come? It will come into the stomach. So it will dilute the acid which is there. So if the acid is diluted, the nuisance value of the acid becomes 0. And then what we have done? We have vomited it out. So if you have vomited it out, it is not remaining here. If acid is not remaining here excess, you will not get acidity problem. You know sulfuric acid, concentrated. If I take it 1 teaspoon and I will ask you, take on your palm, will you take? No. Why? Because it will burn your hand. But same sulfuric acid 1 teaspoon, if I put it 1 full bucket of water and empty that bucket on your body, you will not realize that it was containing acid. Why? Because it was totally diluted. Similarly, we dilute over here by drinking water and then vomit it out. So it will not remain here. You will not get acidity problem or you will not get ulcer. Is it only one benefit? Now, those who have practiced Vaman in the past, they must remembering that if you have taken 6 glasses of water, they might have been able to bring out only 3 or 4 glasses of water. Remaining water will go ahead and it will clean all these 29 feet intestine. If all these intestines are cleaned, what is the function of intestine? Digestion. So your digestion will improve. So you will not get digestive problem. Then some of this water, it will come over here. So there will be excess water into this part. And what contains this part? This part contains the fecal matter or waste matter. So there will be excess water into the fecal matter. So it will not be very hard. So when it is coming out, patient will not get constipation because it is loose and it will be able to pass it properly. If this hard stool, it comes out through this, because of this hardness, it rubs this mucosa and you get bleeding piles. So that problem also you will not get if you are doing Vaman regularly. What else? Now some of this water, it will get absorbed here and it will go to the kidney. When it comes to the kidney, what kidney will say? It is excess, so it will filter out. So you'll get excess urination. Now, because of the excess urination, because of the pressure of the excess water into the urine, whatever small debris are there in that pathway, they will be pushed ahead. If they are pushed ahead, they will not remain there. If they don't remain there, you will not get stone. We operate in the hospital, kidney stone. So a patient comes out of anesthesia. What is the first question he asks? Doctor, stone kidhar hai? Where is the stone? So he said, okay, you take this stone. We tell him, ये stone लेके जाओ घर में, देवघर में रखो, रोज उसकी पूजा करते जाओ. फिर वो घर लेके जाता है, कांच के बरनी में डाल के रखता है. आपके जैसा कोई दोस्त आ गया तो बताते, देखो यहाँ से यहाँ तक काटा, इतना बड़ा ऑपरेशन किया, 50,000 खर्चा हुआ और इतना बड़ा स्टोन निकाला. Has this stone become of this size in one day? It was of mustard size. Slowly layers are put on this, and it becomes big. If you are doing regular woman, whatever small debris are there, they will be washed out because of the excess water into the urine, and you will not get stone problem. So this benefit you get by doing woman. There are 3-4 more benefits. I will skip it because so that I can cover all the things. Who should not do it? That I will tell, because the people who has got heart attack, who has got high blood pressure, who has undergone major abdominal surgery, who has got hernia, who has got an eye problem, increased pressure, that is glaucoma, and in ladies if she is pregnant, and the weak person, they should not do this. What they can do? They can drink 2 glasses of water in the morning and don't take for anything for half an hour. So they will get at least some benefit. So this is importance of the woman. Now, how many times you can do? I told that so many, I didn't tell you another 3-4 points, benefits. So such a beautiful dhoti, so we'll do every day. If you do every day, what will happen? Acid is thrown out, so acid level will become 0. And acid is the first step of digestion. So we require acid. That is why we'll do it once in a week or once or twice a fortnight. We will not do it every day. So this is very important. Remember this. Then these are the all benefits I have given in this. Then we'll come to Kapalabhati. Now everybody must have practiced Kapalabhati. What is the traditional Kapalabhati? Is the normal inhalation, forceful exhalation. In that what happens? Only lower part of the abdomen, below the navel part, it only moves in front and back. I will just show you how it is doing when we do it. Only lower part of the abdomen is moving. I will just show you once over here. I will put my hand here and you can watch it. Now, this is called Kapalabhati. How many times you have to do? You have to do it as per your capacity. There is no perfect rule that we should do it 50 times only, 60 times only, 100 times only. We have to do it as per your capacity. Slowly go on reaching it and go up to maximum 100 or 120 strokes in one single round. Such 3 rounds you should practice. Now, what benefit you get by doing Kapalabhati? Before that, we'll see the anatomy. It starts from the nose. This is the trachea. At the center of the chest, it divides into 2, and then these are the lungs. The trachea divides in the center of the chest. It branches, then again it branches, and ultimately these are the alveoli, Vayu Kosh. How many alveoli are there? Millions of alveoli are there. If you take them out and try to make a straight line, it can make about 2 to 3 kilometers. If you take out both the lungs out and try to inflate with the pump, how much area it can occupy, you know? Half of the tennis court. Such a huge capacitated lung we have been given, and it is into the chest. Now this mucosa, this trachea bronchus is lined by mucous membrane inside, which secretes 1 liter water in 24 hours. What is the use of it? When you are breathing in air, that air might be dry. So to moisten that air, this liquid is used. Can you see this hair-like projections? केश सदृश अवयव दिखते हैं आपको यहाँ पे, इसको कहते हैं cilia. What is the function of this cilia? हम सांस भरते हैं, we are breathing in. If you are on the road, what you will find? Some car passes by and there is a dust part, and that dust particle, they go inside. So these dust particles, they are getting entangled into this cilia, and because of the sweeping action, they are thrown out, they are not allowed to go in. So this important function is done by this cilia. जब हम सांस भरते हैं, when you breathe in normally, it comes just, this is the diaphragm, ये जो पर्दा है, this separates the chest from the abdomen. When you breathe in slowly, it comes 1 centimeter down. When you breathe in heavily, it can come 7 centimeter down. More the diaphragm can come down, more the space is made available, more the air you can breathe in. So that is why this type of chest is provided by the nature. Now this is little important. You are sitting quietly. How much air you are breathing in at a time? 500 ml air in and 500 ml air out. Suppose you breathe in heavily, you can breathe in 3500 ml air in. If you breathe in heavily and breathe out heavily, you can breathe out 4600 ml. That is called vital capacity. Now you are breathing normally, you are breathing in and then breathe out. Have your lungs become totally empty? No, at least 2300 ml air is there. Suppose you breathe out totally. जो लोग योग प्रैक्टिस करते हैं तो रेचक कहा उसने पूरा सांस छोड़ दिया, still 1200 ml is there, means our lungs, they never become empty, there is air, and with each respiration there is exchange of gases. Now a person who is doing sedentary job, sitting at a hotel counter collecting money, what he will do? He will just breathe in 500 ml in and 500 ml air out. So his alveoli, they will just open up to 500 ml and then breathe out. Now to such a person, if you tell, run and catch this bus, this is last bus, if you miss it, you will have to sit at the bus stand for a whole night. Then what he does? He starts running. When he starts running, he feels breathless. Why this happens? Because when you are running, your muscles are working more. When muscles are working more, they require more oxygen. How it can be fulfilled? If you can breathe in more air. But the person who is the sedentary jobber sitting at a hotel counter collecting money, he is just breathing in 500 ml air in and 500 ml air out. So his alveoli, they are just opening up to 500 ml and again breathing out. Now he is running, demand has increased, but what alveoli they say? We are not habituated, we cannot breathe in more air. So to fulfill the demand, he has to breathe fast, and that is why he feels breathless. So if you want to avoid the breathlessness, you have to train your alveoli in such a way that whenever you are working more, running, they should open up more and you should not feel breathless. For that, we do Kapalbhati. Now we have seen that we have done normal inhalation, forceful exhalation, normal inhalation, forceful exhalation. What happens because of the forceful exhalation? All the dust particles in this part, they are thrown out. If the dust particles are thrown out, your passage becomes clean, you will not get difficulty in breathing. Now somebody gets disease. How he gets? Because the virus, it travels through the air, through the nose into the lungs. Now where are these organisms? They are in the dust particle. So along with the dust particle, they go inside. If you are doing Kapalbhati, because of the Kapalbhati, dust particles are thrown out. So one number atom, along with that, the organisms are also thrown out. If they are thrown out, they will not remain here. If they don't remain here, you will not get infection. So this benefit you get by doing Kapalbhati. What more? Suppose few organisms they remain over here, they will grow. What is the favorable atmosphere for the growth of the organism? आपके घर में सब साफ सफाई की है तो वहां पे मच्छर दिखते हैं क्या? You find mosquitoes there. Where is it clean? No. Where you find it? When the drainage pipe is leaking. Why? Because there is a favorable atmosphere. Similarly, in the lungs, the dust and water combination is the favorable atmosphere for the growth of the organism. Now, when you are doing Kapalbhati, dust particles are thrown out, so one number atom is gone. Another atom is water. I told you in this passage, in 24 hours, 1 liter water is secreted. More than 60% water is utilized to moisten the air which you are breathing in. So remaining water, if it remains over here, it will combine with the dust particle and form the favorable atmosphere. Now, when the chances of water remaining here are more? In the winter season, rainy season. Why? Because those days, the air is not dry. So the water is not required to moisten the air. Now, this excess water, if you are doing Kapalbhati and Ujjayi, because of this, there is heat generation. Because of heat generation, water, excess water is there, it will be evaporated. That water will be removed, so there will not be favorable atmosphere. Organisms will not grow and you will not get any illness. So this benefit you get by doing Kapalbhati. One more important, because it is in relation with the corona. When you are doing Kapalbhati, forceful exhalation, what is happening? It is rubbing whole of this passage. If it is rubbing whole of this passage, what will happen? It is rubbing whole of this passage, right? So because of that rubbing, what will happen? This will become totally clean. If it becomes totally clean, the virus which is coming from outside, it will come in contact with the mucosa. Underneath mucosa is what is there? Blood vessel is there. What is there into the blood vessel? Blood is there. What is there into the blood? There are WBC, white blood corpuscles. Yeah, Safed Rakta Peshi. What is the function of Safed Rakta Peshi? It tries to kill the organism by engulfing the organism. That is called phagocytic action. So the phagocytic action will be there. So whatever organism they have come in this, along with the breathing, they will be killed. So this benefit you get by doing Kapalbhati. Now one more thing, in police department or in home guard, every day morning there is a parade. Why there is a parade? They have to stand whole day. So why you are tiring them in the morning? It is not tiring, it is warming up. Similarly, if you do Kapalbhati every day morning, whole of this alveoli, they will be alert. We have seen just now, we can breathe in 4,600 ml air, but we are only breathing 500 ml. So remaining alveoli, they are just lying idle, they are sleeping. So you have to keep them alert. Whenever there is emergency, they will open up. So this is possible by doing Kapalbhati. One more important benefit I'll tell you, if you take one balloon and you want to inflate it with the air pump, when you apply it to the pump, do you put it very fast? What will happen if you put fast? The balloon will burst. But what you do, you slowly pump and the balloon inflates. Similarly, when you are doing normal inhalation and forceful exhalation, when you are doing forceful exhalation, all these alveoli, they get closed. And when you are doing normal inhalation, they are slowly opening. So the elasticity of the alveoli is maintained. So if they are elastic, when you want to work more, they will open up without any problem and you will not get any breathlessness. So these benefits you get by doing Kapalbhati. There are a few more also, which I'm skipping because time constraint. Then we come to the Ujjayi. Ujjayi is the friction breathing. Now, water, cough or secretions are there, which are there here, which cannot come out because of the Kapalbhati. They will come out because of the Ujjayi. What happens in Ujjayi? When you are doing friction breathing, because of the friction, there is heat generation. Because of heat generation, this cough or secretion, they will get liquefied. Once they get liquefied, they can come out easily. Your lung capacity will improve. Now, most important in corona infection and upper respiratory tract infection, sardi zukham, what happens? This is the inner opening of the trachea bronchus. This is normal. But in infection, it becomes small because of the swelling. Yes, sujan aa gaya. This has become swollen mucosa. So it becomes small. Now, when he's breathing, because of the atmospheric pressure, through this small opening, air passes in. But when he's breathing out, that air hasn't got pressure. And that is why to come out of this, it has to struggle. And that is why wheezing sound comes into the asthmatic patient. If you are doing Ujjayi, this swelling will go and you will not have to have strain and wheezing sound will not come. So this benefit you get by doing Ujjayi. Agnisar is the making movements of the abdomen. You have to breathe out totally. एंड इन दैट एक्सेल करनी है, पूरा सांस बाहर छोड़ने का है और सांस रहित अवस्था में हमें पेट को हिलाना है अंदर बाहर. उससे क्या होगा? पेट हिलाएंगे तो आतड़ी हिलेगी, पर्दा हिलेगा, पर्दे की चर्बी पिघल जाएगी. The fat will get dissolved. The less area will be required for the intestine. So when you want to breathe in more air, this diaphragm can go down more and you will not feel breathless. Then there is a pancreas just behind the stomach, which is also activated, and insulin secretion is proper and you will not get any diabetes. So this fat gets dissolved and you get the relief. Now, when you are doing Agnisar, what happens? You take your tummy inside here. So there is a pressure onto this vena cava. So this blood is pushed up. When it's pushed up, there is a negative pressure here. Because of the negative pressure, lower blood is sucked in. With the next movement, this blood comes here, this blood goes there, and it acts as a pump to lift the stagnated blood into the leg to the heart for purification. So this benefit you get by doing Agnisar and Uddiyan. Now coming to the asanas, there are so many bones in our body. In between two ends of the bone, there is a joint. That means there is a space between two ends of the bone. This is the knee joint. घुटने का जॉइंट है. दो हड्डी के कोने में अंतर होने की वजह से जब मैं घुटना मोड़ता हूं तो ये इसके ऊपर घसता नहीं है. When I bend my knee, this doesn't rub against this. But when this space reduces, this end rubs against this, and then I say, oh, my knee is aching. Why it is aching? Because the space between the two ends of the bone is reduced. Why it has reduced? Because the muscles around it, it is not keeping them apart. You might ask, how many muscles are there? This is a thigh bone. All muscles are removed, and here all muscles are there. If you start counting from here to here, about 20, 40, on the backside 15, 20, so many muscles, when they function properly, they keep the two ends of the bone apart and you don't get joint pain. So to keep these muscles toned up, we do different type of asanas. Now this is the backbone, reed ki haddi, vertebral column. It is made up of one vertebrae above the other. This is the disc in between the two vertebrae, and this is the nerve coming out from in between two vertebrae, supplying to the different parts of the body. Now, some patient who has get backache or sciatica, what he says? He says, I get pain in the back and tingling numbness into the leg. Why this happens? Because the space between the two vertebrae reduced. That is why the nerve coming out from here is pressed. That is why he gets pressure pain over here. And the area of the leg, which is supplied by this particular nerve, you get tingling numbness. So if you don't want to have this, what should be the ideal thing? The space between the two vertebrae should be proper, and for that we do different type of asanas. Shavasana करने से whole body muscles relaxes, particularly coronary artery. If all the muscles of the body relaxes, coronary artery relaxes, the diameter of the coronary artery will increase, more blood will flow to the heart and you will feel fresh. So that is the importance of the Shavasana. Now, little bit about the Kriya Yoga. In this, Anulom Vilom 10 times, Omkar 10 times, and Gayatri 10 times. If you are of some another religion, you can practice Amen or Amen. And in Gayatri, instead of that, you can chant your own religion mantra like that. Naukar mantra is there, or in Muslim, there are some other mantras. And then eye closure technique meditation, which is a Kavaladham tradition. If you practice this, it can keep your mind cool. Omkar and Gayatri. By practicing Omkar, you can make your mind thoughtless. Science says that you cannot keep your mind thoughtless for more than 6 seconds. If you are awake for 16 hours, maximum 10% you can make it. That means 1.5 hours. And when your mind is not, mind is thoughtless, the alpha waves are generated, belief system is activated, healing system starts functioning, and body heals on its own. And that is the importance of the Omkar. Gayatri, the way you think you become. जैसे आप सोचते हो वैसे आप बनते हो. यदि हम सूर्यदेव की प्रार्थना करेंगे, कहेंगे सूर्यदेव मुझे तेरे जैसा तेज मिले, मेरी बुद्धि तेरी जैसी प्रगल्भ हो, तो ऐसी प्रक्रिया बनती है, वैसे हम बनते हैं. इसमें जात पात का धर्म का संबंध नहीं है, ये तेज की उपासना है. Now this Gayatri mantra, how it has to be pronounced? So here you can see there is a line below, here is a line above. So here you have to raise this word, here you have to prolong the word. I will just show you once. This you have to say once only. Om Bhur Bhuva Swaha. Om Tatsa Viturvarenyam Bhargo Devasya. दे के लिए नीचे लाइन है. सो देवस्य धीमहि धियो यो न prachodayat. Like that you have to chant for 10 times. So this is all about yoga. I'll just add one doha which is said by Kavi Surdas. He said it was written in 400 years ago that Re mana dhiraj kyau na dhare, Re mana dhiraj kyau na dhare, सवत 2000 के बाद ऐसा योग परे. 2000 साल के बाद ऐसा समय आने वाला. कैसा? पूर्व पश्चिम दक्षिण उत्तर 14 काल फिरे. सर के ऊपर मृत्युमंडल आएगा. 25-30 उम्र के लोग डायबिटीज, ब्लड प्रेशर, हार्ट अटैक, इसके वजह से मरेंगे. सावधान. सुनने वाला हैरान हो गया. कभी सूरदास बेचारे अंधे थे, लेकिन उनको 400 साल के बाद क्या होना तो उसका पता था. उन्होंने कहा काल व्याल से वही बचेगा जो सोहम का ध्यान करेगा, सांस की रफ्तार को नियंत्रित करेगा. यह है हरि की लीला, टाले नहीं टले. यदि हमें उससे बचना है तो हमारे सांस की गति को नियंत्रित करना है, और ये सांस की गति को नियंत्रित करने का शास्त्र मतलब योग शास्त्र है. दैट इज व्हाई इट इज इंपॉर्टेंस. अभी इतना सब सुनने के बाद आप पूछेंगे क्या क्या रोज करना है भाई. सो these few things you have to practice every day. If you want to keep yourself healthy, prarthana, then pranadharana, that is breath awareness, netrasan, jalaniti you should practice daily, jaladhoti once in a week or twice a fortnight, kapalbhati every day, ujjayi every day. Kapalbhati I told you, as per your capacity, do it 3 rounds and that should be practiced every day. Ujjayi 3 rounds, Brahmari 3 rounds, Shitali. Shitali specifically we give for the people who has got high blood pressure. How we have to do? We have to fold the tongue like this and breathe in through that. Close the mouth and breathe out with the nose. So this is called Shitali. This you have to practice. Agnisar Udyan if you get time. Then asanas. You should remember so many times the question is asked, what is the sequence of the asanas? So you remember that when child is born, how is the first time? First is lying on the back. Then after 2-3 months, he start turning on the tummy. After 6-7 months, he starts sitting. And after 1 year, he starts walking. So the asana should be practiced in that. First lying on the back, then on the tummy, then sitting, and then standing. Whenever you are practicing asana, always give 5 minutes when you come inside the room. Suppose you want to start practicing at 8 o'clock and you are out something, so you come running and 7:55 you come and then start practicing. So at least you give 5 minutes in Shavasana so that you get acclimatized, accustomed to that room environment, and then you should start. Because if you are walking, running, then what happens? Your pulse rate has gone up, blood pressure has gone up. So let it come to the normal and then you practice. Then when you are starting, lie down on the back, then crocodile poses, Ardha Halasan, Pavan Muktasan, Setu Bandhasan, cycling. This you practice on back. On tummy, Bhujangasan, Naukasan, Shalabhasan, Dhanurasan. Sitting, Brahma Mudra, shoulder movements, Parvatasan. Parvatasan is simple like this. You just raise both the hands. Now this you can do it in the office also. Vakrasan. Vakrasan you can do on chair also. So nowadays, Ayush Ministry has introduced chair yoga. Those who are working in the corporate sector, do 10 minutes this and you will find relief. Then Simha Mudra, then in standing, Tadasana, side bending and Trikonasana. Now all this you need not practice every day. But this first thing you should practice every day from Prarthana to Shitali. And then one day you practice on back, one day on the tummy, then third day on the sitting and fourth day on the standing. In that also you can make specific. Suppose you are having cervical spondylitis, so Brahma Mudra you should do every day. If you have got backache, then you should do crocodile poses, Bhujangasan, Shalabhasan every day. Like that you have to practice. Now this is most important. This you should practice every day. That is Kriya Yoga, Anulom Vilom 10 times, Omkar 10 times, Gayatri chanting 10 times, and 10 to 20 minutes of Kaivalyadham tradition meditation, which starts with the eye closure technique. Now coming to the current burning problem, yoga in corona, what we should do. So how you get it? It gets because of the virus enters into the nose. So the entry point is in nasal or oral mucosa. It enters into the nose and then go to the trachea and then lungs. So first you get rhinitis when it is the nose. When it comes to the pharynx, you get pharyngitis, tracheitis, and in the lung, pneumonia. And when it becomes serious, ARDS or acute respiratory distress syndrome. Now, why you get this? Abhi sardi, rainy season aega, rainy season will start. So, do you find that everybody is getting allergic rhinitis? Only 5 or 10 people are getting. Why? Because their immunity is low. So, either the virus dose is very high, means suppose in corona, if you want to speak into that, suppose you are standing here, a corona patient is standing next to you and he sneezes and a huge amount of coronavirus is blown out through the nose and you breathe in, what will happen? You will get heavy dose of it. So either you get a heavy dose of it, that is why social distancing, why it is important? Because at least you keep 6 feet distance, so you will not breathe in the air which is corona patient has breathed out. Then low immunity. Now, which immunity? One is the local at the nose and general immunity. So this, because of this, you get corona. Now, what are the effects of corona? At physical level, it affects the respiratory system, and mental level, disturbs mind, feels unsafe, and fear of death. Abhi lockdown band ho gaya, we are going out. So suppose somebody is standing in front of you. What is your first question in your mind? Has he got corona? If he comes near me, what will happen? I will also get corona. So you will cook. And then you have got a fear of death. Oh, so many people are dying every day. You are reading into the paper and seeing on the TV. So you get a fear of death. So this is at the mental level. Now, how you can treat the corona? For physical level, improvement of the respiratory system. मतलब हमें श्वसन संस्थि की इम्यूनिटी बढ़ाना है. So for that, what we'll do जलनीति, कपालभाति, सूर्य भेदन, भस्त्रिका, शिव मुद्रा, भ्रामरी. So this will improve the respiratory system immunity working. And then physical improvement and in the lungs. जो हमारे फेफड़े है, I told you कि so many of the alveoli, they are dormant, they are not working. So to stretch them, so the few asanas will do, which will stretch the thoracic cage, so the lungs alveoli will open up. So what are they? Ardha Halasan, crocodile poses, Bhujangasan, Naukasan, Shalavasan, Dhanurasan, Vakrasan, Gomukhasan, Tadasan, Parvatasan, and side bending Chakrasan. In all these, the chest cage will be stretch. So your lung alveoli will open up more, and that will improve the lung capacity. And then at the mental level, Pranadharana, Kriya Yoga, Anulom Vilom, Onkar Gayatri, and Kavaladham technique, eye closure technique. By doing Anulom Vilom, the proper channelization of the energy occurs. Onkar, proper supply of the energy to the different parts of the body, and Gayatri, try to control it, try to make it effective at the particular part. Dhyan, it helps to concentrate on each part of the body, so healing starts automatically. भगवान ने हमें शरीर दिया है और उसको हीलिंग पावर भी दी है. It heals on its own. क्षमता है, लेकिन उसको जागृत करना है. To activate that, we have to do dhyan. If you do dhyan, slowly your body heals on your own, and then you develop confidence. नहीं, मैं रोज योगा करता हूँ, सब क्रिया करता हूँ, साथ में मेडिटेशन भी करता हूँ, तो मुझे कुछ कोरोना होने वाला नहीं. So you will be confident about that. Yoga improves the immunity. हम केवलधाम में we have studied and we have seen that improves the local as general as well as systemic immunity. The markers we have studied, pro-inflammatory cytokines and anti-inflammatory cytokines. The balance between these two is there, and slowly you heal on your own, so you don't have any problem. Now respiratory rate comes to the normal. Mind becomes undisturbed, it is cool. Decision power improves, and you don't get panicky that I might get corona. So these are the benefits of doing yoga. Now, how it will be implemented in corona? So Swamiji has said that every pathy has got its own limitations. Similarly, yoga too. So no pathy works in acute condition except allopathy. So when it is acute, we have to use allopathy. When it is chronic, there you can use yogic practices. Now, yoga can be at the preventive, roga pratibandhak, curative, roga nivarak, adjuvant, allopathy के साथ में, and palliative, just to give little improvement. So at these 4 levels, yoga can be used in corona patient. अभी corona infection हो गया, तो what are the levels of the patient? The first is that who has come from the area where the lot of he was in red zone. So what we do? We put him in quarantine. Or if he has come in contact with the corona patient, so we put it in isolation. So we can divide it. That first is the quarantine, second is the isolation, third is the, nowadays you must have heard that so many people are positive, but they are not symptomatic. So what are they categorized? Asymptomatic, but positive. And fourth is the symptomatic, those who are admitted in the hospital. Now in this also there are 2 categories. One, they have got mild symptoms, and those who are on ventilator, they are severe symptoms. So now these come into the acute category. So the quarantine patient, isolation, asymptomatic positive, and symptomatic mild symptoms, all these patients can be treated with yoga, and you can definitely get relief. You need not go to the last stage of severe symptoms. Now, current trend is what? The lifestyle has changed, and we are deviated from the nature. निसर्ग से हम बहुत दूर गए हैं. Atmosphere बदली हो गया. Change of atmosphere is there. हमारी खाने की आदतें बदल गई है. Change in the habits is there. Indulging in hoteling. आजकल हम सब लोग होटल में जाना बहुत पसंद करते हैं. जंक फूड खाना पसंद करते हैं, पैकेज फूड खाना पसंद करते हैं. वी नो दैट इट इज नॉट गुड, फिर भी जब शॉप में जाते हैं तो जंक फूड ले ही जाते हैं. Then change in a lifestyle, no health awareness, not caring of family members, because we don't have time. From right in the morning 7 o'clock to 10 o'clock you are out, so you are not able to give time to your family members, so not able to give care also family, and all the time you are on mobiles nowadays. घर में भी लड़का मम्मी को मोबाइल पे चैट करता है, मम्मी मुझे भूख लगी है, जल्दी खाना परोसो. So that also we are talking on mobile. We don't have time to talk directly. This is the current trend. Now, what is the effect of corona? क्या हो गया है? कोरोना के वजह से क्या हुआ? लॉकडाउन हो गया. ये कौन किया? हम बोलते हैं क्या गवर्नमेंट है, गवर्नमेंट ने लॉकडाउन कर दिया, हमारा कैसा होगा? हाँ, हमको सामान लाना है बाहर से, या आई एम नॉट एबल टू गो टू द वर्क, सो हाउ आई विल गेट अर्निंग. So we blame the government or health department. Are they to be blamed for that? No, it is by nature. निसर्ग ने हमें पनिश किया है क्योंकि हम निसर्ग के नियमों के खिलाफ बिहेव कर रहे हैं. So what are the effects of lockdown? लॉकडाउन की वजह से इफेक्ट क्या हो गए हैं? Enough time to do something for health. हमें अब घर में ही है तो योगा सही ढंग से हो रहा है. अभी मेरी खुद की बात बताता हूँ. मैं रोज में जब वर्किंग था तभी हफ्ते में 2 दिन तो मेरी छुट्टी हो जाती थी, उसमें बाकी 5 दिन में 40 मिनट, आधा घंटा, 1 घंटा करता था. लेकिन जब से लॉकडाउन है 17 मार्च से आज तक मेरा रोज 1.5 से पौने 2 घंटा योगा होता है. सो दैट यू आर गिविंग एबल टू गिव टाइम. ईटिंग होमली फूड, यू आर स्टेइंग एट होम, तो घरवाली ने खाना बनाया तो अच्छी तरह से खाना खाते हैं, उसको भी अच्छा लगता है, अरे मेरा ये आज घर में गरम गरम खाना खिलाते हैं. नहीं तो रोज क्या करते थे, डब्बा लेके जाते थे, 2-3 बजे कभी भी खाते थे ठंडा होने के बाद. सो शी इज ऑल्सो एंजॉइंग, और उसको भी सेटिस्फैक्शन है और आपको भी गरम गरम खाना मिल रहा है. वाघ भट्ट ने क्या कहा है मालूम है ना? व्हाट ही सेड, within 48 minutes of cooking you should eat the food so you get a maximum benefit. So that you are achieving now. You are able to spend enough time with the family. घर के लोगों के लिए आप काफी समय दे पा रहे हैं. So your family bonding is occurring. Able to nurture unfulfilled hobbies which give eternal satisfaction. अभी कई लोगों को ऐसे रहता है, अरे मुझे पेंटिंग बहुत अच्छा लगता है लेकिन समय नहीं मिलता है, मुझे पढ़ने का शौक है, समय नहीं मिलता है. So you are getting that time also. So these are the benefits of the lockdown. So benefits of the lockdown, what is doing? It is taking back to the nature. निसर्ग के नियम हमें लेके जा रहा है, निसर्ग के नियमों का पालन करने के लिए हमें मजबूर कर रहा है. So we are all matured, intelligent people of 21st century. Do you need punishment? Revert back to the nature. Follow the nature. निसर्गों के नियमों का पालन करो ताकि निसर्ग हमें बार बार पनिश नहीं करेगा. This is nothing but yogic way of life. Yoga is old Indian tradition, today's need, and going to be tomorrow's culture. Now whole world is ready to follow this culture. हम नमस्कार करते थे, पाश्चिमात्य लोग शेक हैंड करते थे, अभी वो लोग ने भी ये अपनाया ना, शेक हैंड नहीं करते. So they are following our Indian culture. So if they are following all our Indian culture, why should we be away from that? और हम क्या कर रहे हैं? So we should be the first person to follow our own tradition, Indian tradition, and that is the most important thing. So follow the nature. Do you need to be punished again and again? बार बार आपको punishment की जरूरत है क्या? हम सब intelligent people है. So we will follow the nature and we will develop good habits of practicing yoga, following nature. Because आदत एक बार लग गई तो छूटती नहीं है. आदत को इंग्लिश में क्या कहते हैं? Habit. See the fun of the word habit itself. HABIT. Remove H, a bit remains. मतलब आदत अभी भी आदत गई नहीं है. Remove A, bit remains. मतलब अभी भी उसकी आदत है. Remove B, it remains. मतलब अभी भी वो गली में जाके छुपके से सिगरेट पीता है. And do anything, habit remains. मतलब एक बार आदत लग गई तो वो छूटती नहीं है. इसीलिए अच्छी आदतें लगा लो. मैं माँ भगवती को प्रार्थना करता हूँ कि आपको इस माहौल में योग करने की बल और बुद्धि दे और स्वास्थ्यपूर्ण आयु दे और कोरोना को दूर रखे. हरिओम. थैंक यू वेरी मच.
Okay, sorry, we were on mute. Uh, yeah, thank you, doctor. Thank you so much for that session. A few questions before we end. Can you hear me?
Yeah, I can hear you.
Okay, great. There is one question from Nilesh. Which asana or pranayam can be done before sleeping in the night?
Before?
Before sleeping, before going to sleep.
See, the basic principle of doing any asana is that your stomach should be empty. So the best time is doing in the morning. But if you are thinking of doing in the night before sleeping, no asana you can do. Only one asana which is allowed to do after lunch or dinner is a Vajrasana. Why it is there? Because when you have taken lunch or dinner, your intestines, they have to work more to digest the food. So they require more blood. So from where you can get blood? So our calf muscle, they are called second heart of the body, the second heart of the body in the human body. So if you sit in Vajrasan, the calf muscle is pressed. So the blood into the calf muscle, which is collected, it is diverted to the intestine and your digestion improves. That is why after dinner, you can only do Vajrasan before going to bed. But before going to bed, you can perform few kriyas. Those people who are not getting sleep immediately or those who have got sleep problem, they can practice Brahmari 20 times and Onkar 20 times before going to bed. Usually, if they start practicing in another 10-15 days, they will be able to sleep moment they go to the bed.
Okay, great. Nilesh, I hope that answers your question. And doctor, I have a couple of questions here from some people who had forwarded me their questions. Now there are some schools of yoga. There is always not a debate, but kind of there's nothing a ratio about. Some people say you should do more of asana practice. Some people say you should do more pranayam. Would you say there would be like a ratio of 50-50 or 60-40, or what would be more important to do on a daily basis?
See, I will categorize it in according to the age of the person.
Okay.
Till the age of 55, 60, you are young. So you should practice all the yogic practices. In that, all the kriyas should be there, all asanas should be there. Once you cross 60, once you become senior citizen, then there are physical limitations. So those people, they should not give more importance to the asanas. They should only practice few asanas which are necessary for them to keep themselves elastic and flexible. In patients, it should be still less asanas, only few asanas. Now, suppose you want to improve the respiratory system, so little bhujangasana. All the asanas also, you should always remember that you should not try to reach to the final stage always. Then you should not practice it more time. इसमें हमेशा एक सेंटेंस में कहता हूं कि योग ये साधना है, कसरत नहीं है. तो ये बलपूर्वक करेगा तो बलहानि होगी. इसीलिए अपनी खुद की क्षमता के अनुसार कीजिए. अभी आप पद्मासन में बैठे और आपके साथ आकाश जी है, वो भी पद्मासन में बैठे. वो आकाश जी डट के बैठे पद्मासन में. 20 मिनट हो गए, 25 मिनट हो गए और आपको मुंगी आ रही पैर को. आप उसके तरफ देख रहे, अरे ये तो डट के बैठा है, तो मैं पद्मासन छोड़ेगा तो हंसेगा मुझे, तो मैं भी जबरदस्ती बैठता हूं. नहीं. Whenever you feel that you are uncomfortable, you should leave that. So don't categorize it 50-50, 40-50. It is according to your capacity, according to your individual body flexibility. And after the age of 60, it should be less of the asanas and more of the kriyas, because it will improve your respiratory system. That is what important. हमारे शरीर के सभी इंद्रियों को ऑक्सीजन ये पेट्रोल है. ऑक्सीजन कहाँ से मिलता है? तो फेफड़ों से मिलता है. तो फेफड़े की क्षमता अच्छी होगी तो हमारा पूरे शरीर को ऑक्सीजन सही ढंग से मिलेगा और हमारे जो सभी संस्थाएं सही ढंग से काम करेंगे और बीमार नहीं होंगे. सो दैट्स व्हाई यू हैव टू गिव इंपॉर्टेंस एज पर द रिक्वायरमेंट.
Very well explained, doctor. Because nowadays what happens is people look at yoga as a physical exercise. They don't really want to go deeper, and they don't want to understand the deeper meaning of what yoga is all about. So that was great. Okay, another
I
question.
always try to give importance on that. That is why I tried to explain, because so many people, they think some people, they do it blindly. Exactly. But once you understand it, by doing Kapalbhati, this is happening in my lung, so he will do it with consciousness. When he is doing with consciousness, he will get better result. Now I'll just show you one of my book, whatever I told you just now, because I have not covered all the benefits of all the kriyas because of time constraint. This is my book, Yoga Through Doctor's Eye. In this, I have given all the explanations of all the kriyas, and it is up to the full. Means Kapalbhati, I have given about 14, 15 benefits. Here only I told 4 or 5. So you can go through this. So once you read the book, you will be cocksure that yes, if I do Kapalbhati, I will not get corona.
Okay, good. So, doctor, this is available on Amazon? Is the book available on Amazon easily?
Yeah, it is available on Amazon, or even my number is there here. You can take down this number, and on WhatsApp you can send me the requirement. I will tell you how to buy it. Amazon also it is available.
Great. So guys, that's an excellent option. If you want a little more information about this, you can buy the book. Doctor, any asana recommendation for inguinal hernia?
Inguinal hernia is a mechanical defect. Abdomen is called a magic box. Now it has got 3-4 places, small openings. That is called windows, through which the intestines they pop out when there is an increased pressure into the abdomen. And that is why it is called hernia. When the intestine, they come out through some of the windows abnormally, that is called hernia. And this is a mechanical defect. So yoga has got no role into that. It has to be operated.
Great. So let's go on to the next one. I think this you have already answered, but how should the person above 65 deal with hypertension and diabetes?
The person who is above 65, blood pressure
and diabetes.
See, for the blood pressure, I have told you that Shitali should be practiced. And for diabetes, Vakrasana is more important. There are few more asanas also, which is not easy to tell you in 1 minute. But now whatever structure is given for yoga module for diabetes or blood pressure, only one difference in that, when hypertension patient is there, he cannot do the Kapalbhati forceful exhalation. So there he has to do simple Kapalbhati where the forceful exhalation is not there. For that also in this book, I had given the module for different diseases, blood pressure, heart attack, everything I have given in that. I have written one more book, Yoga as Therapy, a medical view. In that, I explained that in which disease, what type of yoga you can practice and why you can practice, and in some disease, why you cannot practice. So what are the indications, contraindications, and limitations of yoga in each disease? That book is also published by Kavaladham. That is available in Kavaladham. That is mainly for yoga teachers, not for a common man. This book is for common man. This common man can read. In this book, explanations I have given, and at the end, I have given the modules also different. In each disease, what module should be utilized.
Excellent. I'm definitely going to go grab a copy actually of both the books. So if you guys want more details, please definitely go grab the book. Another interesting question on diabetes and something to do with nutrition, with food, diet. Doctor, do you think that diabetes generally is a problem with insulin spiking? So do you think, since carbohydrates cause a lot of insulin spike during the day, do you think that carbohydrates should be reduced and maybe fats and protein should be increased?
See, in that I will not categorize with fat or like that. I will tell that you eat whatever you require. Because if the energy input should be balanced with the output. If it is not balanced, what happens? Suppose you are working less and you are eating more. What will happen? The excess food is deposited into the body in the form of fat. When the fat level in the body increases, the insulin has to work more. So there is a burden on the pancreas. So you eat less. Whatever you require, that much energy will not be deposited into the form of fat, and you will not get much problem, because then insulin resistance also increases because of the excess fat into the body.
So basically, we must eat as per our physical activity, as per our activity level.
Yeah, doctor.
Yeah.
Yeah, go ahead.
In fact, I would just meaning the way things are moving now. So, what do you think about mental wellness? And can you tell our guests and audience a bit about mental wellness? How important it is as
See, mental health is mainly dependent upon the thoughts coming into the mind. मैं एक एग्जांपल देता हूं कि आप आपके घर की तरफ जा रहे हैं, रात का समय है और स्ट्रीट लाइट्स चालू नहीं है और आप चल रहे हैं, आपके खिस्से में सैलरी हुई तो यू गॉट मनी इन योर पर्स और आप चलते हैं, चलते चलते आपको क्या होता है, पीछे से कोई तो आने का आवाज आता है, यू हियर द फुटस्टेप्स ऑफ समबडी फॉलोइंग यू। तो आप क्या सोचते हैं, अरे अंधेरा है, रात का समय है, ये आदमी चोर तो नहीं है मेरे पीछे आ रहा, यदि वो चोर होगा तो मेरे खिस्से में सैलरी है तो ही विल टेक आउट रॉब मी, तो आई विल बी लूजिंग माई मनी, तो घर का काम, घर का खर्चा चलाने का है, ग्रोसरी का बिल देने का है, लड़के की फीस देने की है, तो कैसा होगा मेरा, तो यू गेट अंडर टेंशन। फिर क्या होता है, आप स्पीडीली चलने लगते हैं, आपकी स्पीड बढ़ जाती है, अपना पल्स रेट बढ़ता है, ब्लड प्रेशर बढ़ता है, एंड देन व्हाट हैपन, यू आर वॉकिंग स्पीडीली। थोड़े चलते हैं, बाद में सामने से कोई आपके बिल्डिंग का दोस्त आता है और वो पीछे के आदमी को आवाज देता, अरे प्रकाश तू किधर जा रहा था, मैं तेरे को ढूंढ रहा था। तो आपका क्या होता है, अरे ये प्रकाश है मेरे पीछे, मैं खामों का डर गया, मुझे लगा चोर है। सडनली योर ब्लड प्रेशर कम्स डाउन, pulse rate comes down. So why this has happened? Because the thought in your mind has taken that the person who is behind me might be a robber, who might rob my money, and that is why you started walking fast. How it happened? Because the message was sent to the brain that somebody is there behind you is going to rob, so you start walking fast. How? The brain sends messages to the legs. चलो जल्दी जल्दी चलो जरा, वो आदमी पीछे से आपका पीछा कर रहा है, so you start walking fast. When you start walking fast, the muscles of the leg, they said, yes, I am working more, but I require petrol, that means nutrition and oxygen. So brain sends a message to the intestine, liver, that release more glucose. अभी ग्लूकोज रिलीज हो गया, लेकिन वो सेल तक, स्नायु तक पहुंचाना है ना, तो वो कौन पहुंचाता है, ब्लड पहुंचाता है, which is the circulation. Because of the heart pumping, the blood goes to the different parts of the body. So brain will tell to the heart, come on, work fast. Send nutrition and oxygen to the muscle. फिर he gives an order to the lungs also, come on, work fast. You want more oxygen. So in the process, what has happened? Heart has started beating fast. Alveolar, lungs are contracting more. That is why your pulse rate has increased, your respiratory rate has increased. So ये क्यों हो गया? Just one thought into your mind. यदि ये thought process हम control करेंगे तो ये तकलीफ नहीं होगी. And for that mental, and that is why this century is called century of tension. ये सब विचारों का खेल है. So you have to reduce the thoughts and you should have also reduce the reaction to the action. जब एक्शन को रिएक्शन कम हो जाती है तो माइंड साउंड होता है, कूल हो जाता है, तो मेंटल टेंशन नहीं आता, यू डोंट गेट डिस्टर्ब फॉर स्मॉल स्मॉल थिंग्स, एंड दैट इज हाउ यू कैन अचीव मेंटल हेल्थ by practicing yoga. If you are practicing Omkar, Gayatri, then Anulom Vilom and Dhyan, your mind becomes cool, your decision power improves, and you don't get disturbed for small paltry things.
Great. One last question, doctor. Something about nowadays what we see is there are a lot of yoga injuries happening, injuries in the field of yoga also. A lot of people without proper instruction, they follow YouTube, they follow the internet, doing pranayam, especially a lot of pranayam practices. And as we all know that pranayam has to be done very correctly under a proper teacher. If you could just talk a little bit about that, that how dangerous it is actually for people to blindly follow some certain yoga practices.
Initially only I told that yoga is 5,000-year-old science, time tested, but it has to be practiced under supervision of the yoga teacher. क्यों? Because you should know what are the indications, contraindications and limitations of yoga. पहली चीज. दूसरी चीज ये कि जब आप योगा टीचर के पास जाते हो तो आपको पूछेगा, भाई आपको क्या तकलीफ है? हाँ, मुझे ब्लड प्रेशर है, मुझे हार्ट अटैक आया था या मुझे डायबिटीज है, मैं ये गोली ले रहा हूँ, तो उससे क्या होगा, टीचर विल नो द बॉडी composition of the particular person, then he will advise accordingly. अभी जैसे हमने बताया कि ब्लड प्रेशर है तो ही कैनॉट डू फोर्सफुल एक्सहेलेशन कपालभाति ट्रेडिशनल, तो ये कब पता चलेगा, जब टीचर पूछेगा. सो दैट इज व्हाई इट हैज टू बी डन अंडर सुपरविजन ऑफ द योगा टीचर एंड नॉट ऑन ऑब्जर्विंग ऑन टीवी, बिकॉज टीवी पे आप देख के करोगे तो आप यहाँ पे बैठ के कर रहे हैं, जो टीवी पे से दिखा रहा है वो आदमी थोड़ी देखता है कि आप बराबर कर रहे कि नहीं कर रहे. कैन ही करेक्ट यू? You cannot correct you. So it is always better to do it under the guidance of the teacher, in front of the, once you learn everything, then you can do it at home. But for first learning few days, you must be doing it under the yoga teacher's guidance.
Great. That is a very important point that all of us should always pay attention to. And Manish, anything you want to ask?
Yeah, nothing more, Doc. In fact, it's been pleasure to have you with us. And on behalf of the Sutralytics Parivar, I would like to thank you. And I would also like to thank all the teachers and all the team of Sutralytics and also the audience. And you've been here. And I think that quite beautiful information has been shared, very insightful thoughts. And if been practiced on day-to-day basis, it will certainly help the mental health, the physical health, and also the emotional health. Thank you, Doctor. Thank you so much for being there for us. And
Thank you very much. I also thank all the coordinators, Manish Bhai, and the Sutralytics team who has given me the opportunity to share my thoughts, and all the viewers who has patiently heard everything. I hope that they will practice it and they will not get frightened because of the corona threat. Thank you very much. Once again, thank you all.
Thank you so much. Thank you.
Namaste.
Namaste.